Between 20 and 23 years, we've been working with Elements in Alberta. So the initial request from Alberta was to put a single view to help the clinicians so that if they wanted to understand their patient, they could see the data. And I think we were fortunate that clinicians there are very motivated, and right from the start, they saw this as an essential tool to doing their job. Key outcomes, so number one was the shared record. So as well as providing that, we've done some other really interesting things. So in terms of in the UK, it's called GP Connect. In Alberta, they call it Community Information Integration, C2I. And so that takes data from the GP systems and presents it in our shared care record. We worked with 6 vendors, came up with 120 data elements. They all agreed to send those data elements after the patient's been seen. And there you can see it in the clinical record along with the hospital data. Alberta's a really rich tool. Alberta Netcare now connects almost everything that moves in the province. So another piece that's been very successful there is we co-developed an electronic referral system. So from a GP perspective, I've sent a referral for you to Calgary Foothills Hospital. I know immediately that when the referral's been received, when the referral's been actioned, and what the action is. I can see all that in Netcare. So that's been really successful. That integrates every referral from community to hospital for every condition in Alberta. So the lessons from Alberta that can be applied in the UK are numerous. For example, just in terms of clinician adoption, so every 3 months or so, the clinicians would see something new in Netcare. So we'd send a notice out to the clinicians and say, as of June, you can now see immunisations in Netcare. And what that does, it brings the clinicians along because they can feel that the thing isn't evolving and improving. It's not just a static piece. Alberta was really our first very large shared record, and the fact that it's continued for so long is obviously really gratifying. And we've used it and shown it to people from all over the world in terms of when they're looking at how to do theirs. So as Orion, we've taken on the shared care record in Ontario, which is 15 million people, and in Saudi, which is nearly 40 million people. So you can do these things, but I actually like the kind of size that we have with the shared care records in the UK. And the other thing I really like about the way it's being done in the UK is that the clinicians are very much at the table in terms of making sensible decisions around the use of all this data. So I'm very optimistic.